Breathing is a simple act we often take for granted, yet its complexities underpin not only our survival, but also our mental and physical well-being. What if you discovered that the very rhythm of your breath could influence your emotions, cognitive clarity, and even how your brain processes fear? In this podcast episode with Dr. Jack Feldman, a pioneering neuroscientist from Stanford University, we journey into the elegant science of respiration, the mechanics, the brain circuits involved, and how breathing can be harnessed to enhance mental health and performance. Dr. Feldman opens with an exploration of how breathing is generated, bridging the gap between mechanical function and neural orchestration. At its core, breathing exists to exchange oxygen and carbon dioxide, ensuring the body's acid-base balance remains stable, a critical factor since even slight deviations in blood pH can disrupt cellular function. The diaphragm, a powerful yet seemingly humble muscle positioned below the lungs, takes center stage in inspiration. As it contracts downward, it creates negative pressure inside the thoracic cavity, allowing air to flow into the lungs. Complementing the diaphragm are the intercostal muscles between the ribs, which assist in expanding the rib cage during inhalation. Curiously, whether you breathe through your nose or mouth appears to have little effect on the fundamental activation of these muscles, at least at the neural motor level. Nasal breathing dominates at rest due to airway resistance and filtration roles, but mouth breathing becomes necessary during increased ventilation demands, such as exercise. All of these motor commands originate from a tiny but vital brainstem region called the pre-Butzinger complex, a few thousand neurons working in tandem to generate each breath's rhythm. This discovery revolutionized our understanding, identifying this cluster as the primary respiratory rhythm generator. Yet, active expiration, such as when forcefully blowing air out during exercise, engages a second oscillator near the facial nucleus. This system came to be known as the retrotrapezoid nucleus, initially thought to sense carbon dioxide levels, but now known as an independent rhythm controller for active expiration. Isn't it remarkable how evolution shaped these structures? Mammals possess the unique diaphragm muscle, unlike amphibians or reptiles, which rely on active expiration and passive inhalation. This mechanical innovation allows mammals to efficiently inflate millions of alveoli, the tiny air sacs responsible for oxygen exchange that together form a membrane surface area as large as a tennis court hidden inside the chest. By moving the diaphragm just a few centimeters, mammals achieve a 20% increase in lung volume per breath, efficiently refreshing oxygen supply without conscious effort. Breathing does more than supply oxygen. It exquisitely communicates with the brain and body in powerful ways. For instance, sighs, those involuntary deep breaths occurring every 5 minutes, serve a vital physiological purpose. By taking a bigger breath than usual, the lungs prevent alveoli collapse, preserving the surface area critical for gas exchange. Early mechanical ventilation for polio patients highlighted this. Mortality dropped only when intermittent large breaths were simulated, mirroring natural sighs. More dramatically, changes in breathing patterns intimately influence brain states. Stress, relaxation, and emotional changes all accompany shifts in breathing, but intriguingly, deliberate breathing manipulation can in turn modulate these mental states. Dr. Feldman recounts groundbreaking work where rodents were conditioned to slow their breathing tenfold without harm. Remarkably, after 4 weeks of daily slow breath practice, these mice showed significantly reduced fear responses in standard fear conditioning tests, almost equivalent to direct interventions in the amygdala, the brain's fear center. Why does breathing hold such sway over emotions and cognition? The answer likely lies in multiple intersecting pathways. Rhythmic airflow through the nose sends signals to the olfactory bulb, which projects widely across the brain, constantly modulating activity. Vagal afferents from the lungs report mechanical lung expansion to brainstem areas, influencing autonomic tone and emotional regulation. Indeed, vagus nerve stimulation is used clinically to treat refractory depression, hinting at this nerve's role in mood modulation. Carbon dioxide levels in the blood also modulate breathing and brain function. Small shifts in CO2 alter blood pH, subtly influencing brain chemistry and driving ventilatory responses. Chronic imbalances, like those caused by hyperventilation, can trigger panic attacks and anxiety. Therapies aimed at restoring CO2 levels by slowing breathwork have provided relief for anxious patients, underscoring the biochemistry behind breath-emotion links. Moreover, breath control activates descending commands from the motor cortex, simultaneously influencing multiple brain networks beyond mere respiratory control. By voluntarily modulating breathing, one may disrupt pathological neural circuits involved in depression or anxiety. Dr. Feldman offers a vivid analogy. Persistent emotional states are like deep ruts on a dirt path. Breath practice gradually fills those ruts, enabling escape from destructive patterns. Breathing rhythm touches almost every bodily function. The heart rate fluctuates with respiration, known clinically as respiratory sinus arrhythmia, slowing during exhalation and speeding during inhalation. Even pupil size pulsates with breath, and many sensory and motor systems show coordination with respiratory cycles. Such pervasive influence reveals that breathing is not isolated but deeply integrated with how we move, perceive, and react. These observations elevate breathing from a metabolic necessity to a central player in behavioral and emotional regulation. Could this be why so many ancient practices, from meditation to breathwork and yoga, seek to manipulate breath for mental calming and focus? Modern science now supports these ancestral intuitions with mechanistic evidence. For those eager to translate this knowledge into practice, Dr. Feldman shares his personal approach of brief but consistent breathwork sessions, often employing box breathing, equal counts of inhalation, hold, exhalation, and hold. Just 5 to 10 minutes can produce noticeable benefits, whether counteracting post-lunch energy dips or managing stress. Dr. Feldman's research interest extends beyond breathing mechanics to cognitive enhancement through supplementation, particularly magnesium l-threonate. This form of magnesium crosses the blood-brain barrier more effectively than common supplements and supports synaptic plasticity, known as long-term potentiation, essential for learning and memory. Clinical studies with older adults suffering mild cognitive decline demonstrate improvements equivalent to reversing several years of age-related cognitive loss after just 3 months. Like breathwork, such interventions hold promise for preserving brain health and performance. Breathing is often relegated to the background of our awareness, yet it pulsates at the intersection of biology, emotion, and cognition. Dr. Feldman's insights reveal that breath is not just air in and out. It is a vital signal modulating brain circuits, physiology, and behavior. The lungs and brain are engaged in a continuous dialogue, shaping who we are in subtle yet profound ways. What if the secret to better mental health, enhanced focus, or greater emotional resilience is as accessible as adjusting your breath? How might we harness this primal rhythm to rewrite patterns of fear, anxiety, and depression without invasive tools? Could consistent breath practice, paired with strategic supplementation, offer a roadmap to sustained brain vitality? Breath is the invisible thread weaving together body and mind, a rhythmic bridge that science is just beginning to unravel. From the microscopic dance of alveoli to the firing of specialized brainstem neurons, each breath carries the potential to influence our mental landscape. The question is not whether breathing is important, it's how consciously we engage with it. By tuning into this ancient automatic rhythm, we open doorways to health, performance, and emotional balance. Next time you breathe, pause and wonder, what story is your breath telling your brain today?